Did you know that 1 in every 20 preschoolers has an eye problem that can lead to permanent vision loss if left untreated? That nearly 2,000 eye injuries happen each day in the workplace alone? That blindness and vision loss cost our nation $51.4 billion a year. But half of all blindness can be prevented. Cost-effective measures like vision screenings, public awareness efforts, and improving public health policies don't just save money. They can save your sight. Since 1908, Prevent Blindness America has been dedicated to preserving eyesight for millions of Americans. We are the nation's leading volunteer eye health and safety organization, and we're committed to fighting blindness and saving vision. Through education, advocacy, vision screener certification, research grants, and community-based patient service programs, we touch the lives of millions of people every year.
In my role at Prevent Blindness America, I oversee government affairs, public affairs, communications, and marketing. And essentially, we work to build greater relevance not only for Prevent Blindness America, but to build relevance for vision loss and vision loss prevention. Prevent Blindness America partners with Vision Service Plan. VSP provides nearly $2 million in free vision care each year, and that basically means a free eye exam or eyeglasses for families that are in need. Our challenge is to get consumers to recognize the need for regular eye care.
Whether it's fighting the devastating effects of age-related eye disease or simply helping kids read what's on the blackboard, Prevent Blindness America is there to help. In communities around the country, our screeners check the eyes of millions of children and adults every year, and we make sure those with potential eye problems receive the care and treatment they need. By offering the only national certification program for vision screeners, training 2,500 new screeners every year. By setting strict and comprehensive standards by our adult and pediatric advisory committees. We help bridge the gap from preventative screenings to positive outcomes.
We partner with Prevent Blindness America along with 185 other community organizations to create volunteer projects where volunteers can come in and help provide services.
It's a wonderful opportunity to prevent something from happening or detect what might be a problem and address it early on.
And by going through like a 10-minute process, you can figure out whether a kid needs additional assistance, needs a pair of glasses, or you can even save their sight. For the large part, Chicago Cares volunteers do the work that helps make the program possible so that Prevent Blindness America can focus their attentions on recruiting vision screeners, so trained volunteers.
For myself, had I been exposed to something like this early on, I probably would have been able to do better in school. I didn't learn until I was 22 years old that I had a vision problem.
The first step towards prevention is awareness. We start in local neighborhoods with educational and outreach programs. We work in the nation's capital with media campaigns and special events through our website and newsletters. Prevent Blindness America promotes the value of regular professional eye care and raises awareness about the steps people of all ages can take to enjoy a lifetime full of light and color, faces of loved ones, of independence, and of hope.
Towards the latter part of my father's life, his vision began to deteriorate. I had no idea what was wrong with him, and that was the first time I became aware of glaucoma and the fact that it was hereditary. I went in and started treatment with an ophthalmologist, and for a number of years, and he controlled me very, very well. But then my glaucoma began to get into some advanced stages. Thankfully, he then referred me to Dr. Olivier, and that's how I became a patient of hers.
Glaucoma is a disease of the optic nerve, and the optic nerve is what transmits information from the back of the eye to the brain, and it If your optic nerve gets damaged, then you lose your side or your peripheral vision, which gets smaller and smaller.
I remember when it really manifested itself one time. I took some customers out and we were in Champaign at a football game. And during halftime, I could not see. I couldn't see the field clearly. And I drove that day. And for some reason, by the time the evening came, it cleared up and I saw fine. But I told it to my wife, and that's what prompted her to send me to an optometrist.
And what happens when you speak?
Jaws drop.
Yes, because what do they say when they come up to you?
No one knows about not swimming with contacts. No one thinks of any risk. And when I spoke at the congressional briefing, we took a hand vote of how many people wore contacts. More than half the room raised their hand. And we asked them how many knew that you should not swim with your contacts, and no hands went up.
Our money is not put into eye research as much as it should. And House Bill 2671, again, will help with that. We are begging these representatives to sign on to the Congressional Vision Caucus. And now that we just had a new election, it starts all over again.
Prevent Blindness America is the national voice for vision loss prevention. But the power of that voice begins in communities and small neighborhoods across the country. As that voice grows louder, it drives our ability to inform, to motivate, and to drive change. We've engaged our grassroots and netroots supporters to advocate for vision program and research funding at the Centers for Disease Control and Prevention and the National Eye Institute. We've championed the work of the Congressional Vision Caucus and have lobbied for a national initiative on vision health. By partnering with public health agencies and state and federal government healthcare providers, we can accomplish more than ever before to save sight and prevent blindness.
Prevent Blindness America has not only a local but grassroots sort of presence, in that it can work with local ophthalmologists and optometrists and local alliance programs, but it also has a national presence, and I think that's very important.
For nearly 100 years, we have fought vision loss. Along the way, we've developed strategies and tools to make that fight more effective. And we've proven again and again that prevention and education work. But that takes a lot of effort. And our future depends on empowering our expanding grassroots network for state and national advocacy. It means building our program capacity in more communities around the country. It means finding every person who needs vision care and working ceaselessly to provide access to the available treatments. That is our vision. Won't you help us?
In 2008, Prevent Blindness will celebrate its 100th year. As we look forward from 2008 to the year 2020, there's three things we want to accomplish. We want to make sure that every child in America is getting appropriate eye care before they start school. We want to double the number of eye exams that adults receive every year, particularly adults over 40. And we want to reduce by half the number of eye injuries that occur. That's our goal for 2020. We need your help in two ways to get there. One, we need you to be aware of your own need, to be concerned with your eyes, and get the vision care that you need. And secondly, we need your support. We need your support as volunteers. We need your support as financial contributors as well. So won't you help? Thank you.